Welcome to this detailed overview of hantavirus. We will explore what it is, how it's transmitted, the diseases it causes, and importantly, how to protect yourself. The name hantavirus encompasses several types of viruses carried by rodents, which can cause severe, sometimes fatal illnesses in humans. Understanding this virus is crucial for public health. Hantavirus is a genus of viruses in the Hantaviridae family. It was first identified in the Hantan River area during the Korean War, but the viruses have circulated globally for centuries. Hantaviruses are broadly classified into two groups: New World hantaviruses, which cause hantavirus pulmonary syndrome or HPS, and Old World hantaviruses, which cause hemorrhagic fever with renal syndrome or HFRS. A key aspect of hantavirus is its mode of transmission. Unlike many viruses, it is not typically spread from person to person, but rather from animals to humans. Humans become infected primarily by breathing in aerosolized virus particles from rodent urine, droppings, or saliva. This usually happens when contaminated areas are disturbed, such as sweeping an infested shed. Different hantavirus strains are carried by specific rodent hosts, which include the deer mouse in North America, the cotton rat in the southeast US, and various field mice in Asia and Europe. The virus does not typically make the rodents sick. While HPS is mainly found in the Americas, HFRS is concentrated in regions of Asia and Europe. Cases can occur year-round, but activities that increase exposure to rodents, like cleaning out cabins in spring, often lead to seasonal peaks. HPS, or hantavirus pulmonary syndrome, is the severe respiratory illness caused by New World hantaviruses. It can rapidly progress to life-threatening conditions. After an incubation period, HPS begins with a prodromal phase that can last several days. Symptoms often mimic the flu, making early diagnosis challenging. Initial symptoms include fever, severe muscle aches, especially in the large muscle groups, fatigue, headache, dizziness, and sometimes gastrointestinal issues like nausea, vomiting, or diarrhea. The cardiopulmonary phase is characterized by a rapid decline in respiratory function. Symptoms include a non-productive cough, rapid onset of shortness of breath, and fluid accumulation in the lungs, leading to respiratory failure. HPS is a serious disease with a high mortality rate, often around 38%. Rapid medical intervention is essential once the cardiopulmonary phase begins. HFRS is caused by Old World hantaviruses and is characterized by a different set of symptoms, primarily affecting the kidneys and vascular system. HFRS also starts with flu-like symptoms. However, it progresses to cause capillary leak, low blood pressure, shock, and acute kidney injury or renal failure. The defining symptoms of HFRS include intense fever, headache, back and abdominal pain, followed by hemorrhaging and acute renal failure, which may require dialysis. Early diagnosis is crucial for improving outcomes for hantavirus infection, but requires a high degree of suspicion based on clinical presentation and history of rodent exposure. If a patient presents with a compatible illness and a history of exposure to rodents or their excreta, doctors will use serologic testing to look for hantavirus-specific antibodies in the blood. Treatment for both HPS and HFRS is primarily supportive. HPS patients require aggressive intensive care, often including mechanical ventilation to support breathing. HFRS treatment focuses on maintaining fluid and electrolyte balance and managing renal failure, possibly with dialysis. Since there is no vaccine or specific cure for hantavirus, prevention through effective rodent control and avoiding exposure is the most important defense. To prevent exposure, seal up holes and gaps in homes and garages to prevent rodent entry, set traps to eliminate rodents, and clean up food sources and nesting materials. Never sweep or vacuum up rodent droppings. Instead, ventilate the area, wear gloves and masks, spray contaminated areas with a bleach solution or disinfectant, allow it to soak, and then wipe up the materials with a damp mop or cloth.